Thank you for having me. So, as she said, I am a veterinarian. I own a group of hospitals in Northern Virginia and all small animal. I don't really do a lot with deer typically, but I got involved because I lived in an area in Fairfax County that was very close to a large green space, a riparian tract. And I walked out there one day and I looked up and I saw somebody in a tree with a bow and arrow, and they were there for deer management. It concerned me because this was probably less than 50 or 60 yards from my house, and my kids run out through there. Now, they did have posted on the trail that sharpshooting was in progress. My kids run through the woods. They don't follow the trail, so it did cause me some concern, and I had been involved I have a nonprofit, Chase, that we do a lot of trap, neuter, return for cats, feral cats, and it's a management program. And it's a very controversial, very passionate subject, and I found that deer management is just as controversial and passionate. So I ended up getting involved with the Fairfax City project for the surgical intervention, and it's been actually a very eye-opening experience. I've been involved with that for 5 years. Whoop. Trying to figure out how to. Yeah, I'm hitting the clicker, but it's not doing anything. Awkward pause.
It's not like I know what I'm doing.
There we go. All right, so this will just kind of blow through all of that. I am in the process of opening a compounding pharmacy, hopefully with the potential of helping to generate medications that can even be used in wildlife management. So what I'm going to talk about today, and I'll try to go through this fairly quickly. If I end up talking too long and eating too much into lunch, please throw things at me or give me mean looks. We'll talk a little bit about the overall care and procedures with surgical management, the anesthesia, the pain control, the safety. I'll let Tony speak more to the efficacy long term, but we'll go ahead and start talking. So in order to get the deer to me, there's baiting. Baiting is done in an isolated area. You want a place that's quiet and it's safe for the deer. It's also safe for the people around since there is darting. With the darts, you've got basically a 2 cc dart with a transmitter attached. That's the clear part on the lower one. Typically, the darting is done from a vehicle or from a blind. The goal is not to be seen and to be as stealthy as possible. The goal is to reduce stress to the deer. Let me go back. So the medications that are used in the dart, we have tilazole and xylazine, and I'll try not to bore you too much with information about medications, but tilazole is actually a combination medication of taletamine, which is an anesthetic, and it has some pain properties as well, and it also has zolazepam, which is related to Valium. So it actually reduces anxiety, and the two together actually are used in small animal medicine all the time, and they're used as a good anesthetic combination. We also add in xylazine, which there have been some recent studies with that actually show that actually works even better in ponies for surgical pain, and it may work better than even the morphine type products. What we all tend to think of as the good drugs. So once the deer is darted in the field, it takes probably about 5 to 10 minutes for it's darted. It kind of runs away. There's the tracker. That's why the transmitter's on the dart. The deer can be located with that transmitter. Once they go, they lay down. The goal is, again, to minimize stress. We don't want to capture using nets and things like that actually really stress the deer out, cause lots of fight or flight hormones to be released, and that's oftentimes what ends up leading to a mortality in some of the projects where that sort of capture is done. So once they are asleep, the biologist in the field will actually approach them then, and they'll lubricate the eyes to keep them from drying out. They'll put a mask over the face because they're still, although it's an anesthetic, it still takes a while, and stimulation can lead them to stay a little bit lighter. The goal with anesthesia in deer, from my perspective, is to have them asleep enough to get the job done, but have them light enough that we're not prolonging the recovery period, because that actually adds additional risk. So once the deer is asleep, has been masked, and we use actually it's just sleeves of sweatshirts. You pull them up over the face. It's a perfect fit. They don't see anything, out of sight, out of mind, hopefully. Then we call in the transport team, and they'll quickly pick up and transport back to the field hospital. And when I say field hospital, most people, when I talk to them about it, they're envisioning that I'm bringing deer into my small animal clinics and going into the surgery room. That's not what happens. So we're kind of a hybrid between what happens on large animal, like with farms, where things are done literally in the field, or they're done in a barn that is not a very clean area. We don't do it there. Some things can be done in the field if we're dealing with males. I believe that's what happens on Staten Island is for the vasectomies. They're done in the field. That's a very quick procedure, and it's safe enough to do, and it works well. But for females, we do bring them in. We actually have a MASH-style clinic that we set up, and this is also very similar to things that I do when I do feral cat management. We'll do projects with cats where we'll do about 300 cats in a day, and there's a lot of logistics behind that. We don't do nearly as many deer in a day, but we can still manage a decent amount. So when they're brought in Fairfax City, our MASH setup was actually, I think, fairly cushy compared to a lot of them. We were actually in a sally port at the police station, so it was temperature controlled. We weren't freezing other than when the door was raised, but so it was actually pretty nice. For surgical preparation, so once the deer comes in, everyone's quiet. I mean, you want to just keep everything as quiet as possible. They're assessed. The dart wound is clipped, cleaned, and flushed. We tag the ears. We will place a radio collar on. I think in the earlier projects, more radio collars were done. And Tony, correct me if I'm misstating anything. I believe at this point the collars are used for the adult females, not the younger ones that may be leaders with the herd, so that they can also be used to locate the herd for monitoring purposes or to help capture additional ones in the herd. After the collar's done, like I said, we do an exam. We do find problems with some of the deer. They will have, we've had some that have had broken legs that were chronic injuries, but they seem like they were okay. They had healed. They just weren't healed in a perfect position. But still, the deer was healthy. Body weight was good. So we elected, to allow that one to be released. There also, we've seen lacerations that were chronic lacerations. We'll repair those. So we go beyond what is just the surgical sterilization, the ovariectomy. Beyond that, we will give them antibiotics. We give, it's a cephalosporin, it's a broad spectrum antibiotic. It's something that we probably all will get if we're in the hospital at some point. We give Banamine, which is an anti-inflammatory medication. It's used actually for pain control. My horse just had it last week when he was colicking, but so that's used. We'll actually place an IV catheter, and in that catheter we'll then use during the procedure to administer IV fluids. We also use a pulse oximeter on the tongue, like they place on people's fingers to monitor the heart rate and the oxygenation. The surgery itself, we actually do a ventral midline incision. It's just like spaying a dog. I was actually surprised. I thought the deer would be more difficult to do, but the procedure itself is, it takes maybe 15 to 20 minutes. We go in, we are removing the ovaries. Now, a spay for a dog or cat is actually removing the ovaries and the uterus. We're not removing the uterus. The uterus is pretty big in deer, and it's just better left alone. So removing the ovaries accomplishes what we need. We actually do closure with staples and suture material. The staples, I've had a lot of people ask me about the staples and, you know, who's removing them. And, well, they end up coming out. The deer that have been observed at a later point, the staples are just gone. So either they're grooming them out or they're just falling out. The body has a way of pushing things out that don't belong. The recovery period itself, so the procedure itself is about 15 to 20 minutes. And then, again, once we have given all of the medications and done everything, then the transport team will take them back out to the field. And the reversal, tolazoline, it actually just reverses xylazine. We're only reversing one of the drugs. The other drugs will eliminate gradually. The IV fluids that we give help to speed up the elimination of the drugs, but the tilazole and the ketamine, they will probably last in their effects for maybe about an hour. So the reversal is given IV. It's given slowly over about 5 minutes. And then once that's administered, we're monitoring the heart rate and the respiratory rate. And once that starts to normalize, starts to come back up, they'll back away and stay maybe about 30 yards away and just observe the deer until it actually gets up, and which takes maybe about 20 minutes typically. It'll get up and wander away. Now, typically these deer are starting to graze within about 30 minutes of recovery, and the recovery is something that you need volunteers on the ground for days afterwards, typically, just trying to monitor and see. If they're radio collared, it's pretty easy. You can locate them. Without that, they'll typically go back to the bait stations within 24 hours, so it's typically not that difficult to monitor them afterwards. The success rate, or I'll say the mortality rate, has been very, very low. As Tony said, it's like 2.7%. When I talked with other veterinarians and I talked with other people that had done things with deer in the past, most of what they were telling me was just about the high mortality rates associated with anesthesia in deer. So when I first got involved, I wasn't entirely sure how this was going to go. But what I can say is that by trying to keep them lighter, and we'll give additional medications if needed, if the procedure takes a little bit longer, we've actually had very, very good success. 2.7%, I mean, we expect that these are animals that are being anesthetized that we didn't do exams on prior to the anesthesia. Just like in the human population, probably 2.7% of us have something that if we had an anesthetic today, probably things wouldn't go well. So without intervention, but at least we can have exams, blood work, all sorts of diagnostics beforehand. So 2.7% is an amazingly low number for having no information prior to the anesthesia. In Fairfax, and I don't remember the exact number of deer we've done in Fairfax City. Do you know, Tony? It was like maybe 60? Yeah, 63. We had one that we ended up euthanizing. We didn't lose any to like an anesthetic death. The one that we euthanized, there are potential problems that can happen just in the entire process. We had a dart, and in young deer, they don't have a lot of muscling in their back legs yet. And the dart, if it hits in the right place on the femur, it can actually break the bone. So that deer had a broken leg, and we elected to euthanize that. But that was rare, and that was 1 out of 63. And I would argue that out of those 63 deer, without surgical intervention, we would probably see at least one of those be hit by a car and have multiple broken bones, or have worse things happen to it potentially. So finding veterinarians and technicians is definitely a challenge. There are a lot of people out there that are very interested in doing things like this. It doesn't necessarily mean that they're going to be the best at it. Everybody's got, an interest because it just sounds cool and bizarre, and and it's like everybody wants to be cool. So I got involved because I felt like there had to be another alternative, something. I wanted to be a part of a solution. When I think about like my staff, I've got staff that clamor. They're always asking me, when's the next project? When's the next project? I've got plenty of veterinarians that have been interested. Most of the veterinarians that are interested are the younger veterinarians because they're still in that mode. When they're really young, I would say under 5 years out, they probably don't have enough surgical experience yet. Not all of them, but they don't have enough of a comfort level to go in and be as efficient as we need with surgery. So if you're going to do a project and you're looking for veterinarians, my suggestion would be at least target veterinarians maybe that 5 to 7 year period out. 5 to 7 years is when they're all getting a little bit bored because they've learned a lot of what they need to learn, and they're trying to figure out what they're going to do with their life. So a lot of them are looking to expand their horizons and do new things. And then you get people like me who've been out for a lot of years, and I guess I have ADD, and I'm looking for other things too. So I think that surgical experience, one of the things I would point out is that it's good to actually have probably somebody that's paid to be there because the hours are very long. It's multiple, it's all night long, and most veterinarians are not going to be able to commit that amount of time. So either you find someone like me who I just kind of can come and go out of the practices, but there aren't that many of me like me out there probably that would be willing to stay up all night. But I think if you have someone that's paid, then you can actually bring in other veterinarians where they can actually see it, because that's going to be one of the things that will turn a lot of veterinarians away, is they're like, I don't know anything about deer. That just sounds scary to me. I don't want that responsibility. But if they see it, it's actually not that different than any other, like I equate it to spaying a Great Dane, because that's about the size for a lot of them. So if there's a takeaway that I'd like you to have from this, is that I believe this is I think the procedure itself, although labor and resource intensive, it clearly keeps them from reproducing. And I do think that it's safe, as far as a welfare perspective. I feel like we actually provide a lot more welfare for these patients that we're working on than in many other parts of the world with just standard veterinary care. So I feel like the pain control is adequate. I feel like the the results ultimately speak for themselves. I think we've had very good success in Fairfax City. So, with that, I guess if there are any questions.